Explorers are delicate pointed instruments used for the tactile examination of tooth and restoration surfaces and their margin juncture. The Explorer is used before, during, and after scaling and root planing to assess the amount and distribution of calculus and root surface irregularities. The intended objective should determine the choice of Explorer. The objectives of this program are to prepare the learner to be able to identify the basic design features and areas of use of the EXD 1112 Explorer, to practice the correct grasp, angulation, adaptation, and stroke used with the EXD 1112 Explorer. The basic design features of the EXD 1112 Explorer include the handle, the shank, and the tip. The extreme end of the Explorer is referred to as the point. Because the shank is longer and more angled, the Explorer is easily adaptable to posterior proximal surfaces. It is particularly useful for exploring deeper periodontal pockets. A light but firm modified pen grasp should be used. For this demonstration, we'll be working on the buccal surfaces of the mandibular posterior teeth. Establish a fulcrum close to the tooth being explored. Before inserting the tip into the sulcus of the distal buccal line angle, determine if the lower or terminal shank is parallel to the surface being explored. If it is not parallel, select the opposite end and recheck. Once you have selected the correct end, carefully insert the tip with a short vertical stroke. Insert the Explorer until resistance of the junctional epithelium is felt on the back of the working end. The side of the tip must always remain correctly adapted to the tooth to prevent injury to the tissue. The sharp point will pierce gingiva or epithelial attachment. While maintaining a fulcrum, use the hand, wrist, and lower arm to move the Explorer from the distal buccal line angle into the proximal. Short, overlapping strokes should be used, making sure to pivot on the fulcrum finger. The instrument tip should be adapted to the tooth at a 5 to 20 degree angle. When the proximal contact prevents further movement of the Explorer, carefully remove the Explorer and reposition it at the distal buccal line angle. The tip should be pointed in the opposite direction and will lead the strokes across the buccal surface, past the mesial buccal line angle, and onto the mesial surface. When resistance is met at the mesial contact, carefully remove the Explorer. Reposition your fulcrum finger and repeat the procedure on the adjacent tooth. You will note that the instrument was placed at the distal buccal line angle 2 times. This area should be overlapped slightly so calculus will not be overlooked. The working end of the Explorer that is used for the buccal aspect of the mandibular right posterior can also be used to explore the lingual aspect of the mandibular left posterior. Use a mouth mirror to retract the tongue. Practice holding the mirror with your free hand while positioning and using the Explorer. On the lingual aspect, the starting point will be the distal lingual line angle. In review, a few important points should be noted. Start on the distal most posterior tooth and progress towards the anterior of the mouth. Always use a light but firm grasp. Use the terminal shank as a visual cue for end selection. Use light strokes so calculus can be more easily detected. And always keep the side of the tip adapted to the tooth at all times. Don't be discouraged if at first the instrument feels awkward and you don't feel the calculus. Good tactile sensitivity takes time and practice to develop.